Hi, Dr. Becca here. I am recording a extra video to add to our Lean In and Learn video series for behavior technicians. It is past our initial November 2021 Lean In and Learn sort of online event. And it was so well received, and we received so much positive and thankful feedback that we are going to continue to add videos to the YouTube page to create an online library of videos that are aimed specifically at supporting our behavior technicians, registered behavior technicians, paraprofessionals, therapists, direct care staff, whatever language is used to describe your job of providing direct behavior intervention to individuals who would benefit. This is for you. This one is going to be about pride skills, so PRIDE. Before we sort of jump into the actual pride skills, I want to just talk a little bit about PCIT, or parent-child interaction therapy, since the pride skills do come from or are a component of PCIT. PCIT came to be in the 1970s by Sheila Iberg. It was developed for parents and children aged 2 through 7, who were exhibiting disruptive behaviors, or sort of those outward, we might call them maladaptive behaviors, that were getting in the way of their success across environments. It is an evidence-based intervention, and I want to be clear that watching this video does not prepare you to implement PCIT. PCIT, again, is an evidence-based structured intervention delivered by mental health professionals, where it's a parent and a child dyad in a room. The therapist is in another room watching through a one-way mirror. The parent's wearing what's called a bug in the ear, something in the ear, and then the therapist, the clinician, right, I'd be in the other room coaching the parent on what to say and do to implement these different techniques in PCIT. PCIT is an average of 15 weekly sessions, although it's based on performance, not just length of time. So some folks take longer to go through that. And there's two different sections. There's the CDI, or child-directed interaction, and then PDI, or the parent-directed interaction. So the pride skills are throughout PCIT. It's not specific to just one of the sections. And really, it gives some great skills and strategies for connecting with kids. Right? PCIT is really about strengthening that relationship. And that's super important in behavior analysis as well, right? People don't care what you know till they know that you care, which I guess is a bit of a hokey quote, but I believe it does speak to something important, which is that we learn more and better when we feel safe and secure and have a relationship with someone. So these can be strategies that can help with what we often call pairing, relationship building, whatever you want to call it. And I'm going to do a screen share. I want to be sure that I'm being clear that the again, that using these strategies does not mean that you are trained or that you are able to implement PCIT. It means that you have learned the pride skills. And I think, and I hope that they're helpful for you as you work to establish strong relationships with the kids you're working with. This is also not protected information. It is available freely online. This one comes from UC Davis Health. So I'm going to go ahead. PRIDE is an acronym. You know we love acronyms, and so do many other fields, right? So the praise, reflect, imitate, describe, and enjoy. And I'm going to go through these separately, or more specifically. So pride, the P is praise. Praise appropriate behavior. So we want to tell the individual what they're doing that's great, right? If you say, oh, Dr. Becca, I already know this. Yes, you probably know a lot of these things, and hopefully it's a great refresher. Maybe there's some things that are new, and it gives us that acronym of PRIDE that is likely a helpful one to remember and teach to others. So we want to praise that appropriate behavior or the desired behavior because we know, we're hypothesizing, right, that praise is reinforcing, and then we're going to see an increase in the behaviors that we're praising. And it's important for it to be specific praise, right? In PCIT, they call it labeled and unlabeled praise. We probably in ABA call it more specific praise. So unlabeled praise would be good job, nice, right? This is praise statements, but it doesn't really tell the other person what exactly they're doing that's receiving the reinforcement or the praise, right? So an example would be, let's say you go to the bathroom and we're working on potty training with a child. They go to the bathroom, they void in the toilet, they get up, they pull their pants up, they wash their hands, they come out of the bathroom, and then you're like, nice job. They really don't know what part of that behavior chain resulted in the praise, right? So we want to say, nice job coming out of the bathroom. Nice job pulling your pants up. Way to clean up, right? That's labeled praise. It's very specific about what behavior is resulting in the praise. And when I know what it is that I did that is good, that you're enjoying, that resulted in your attention, if that's reinforcing to me, I'm going to do it more. So again, it's that praise appropriate behavior. And it can be anything from way to keep 2 feet on the floor while you're sitting down. Thanks for cleaning up. Thanks for asking for help. Way to try something new, right? These are all specific praise statements that lets the individual know what it is that they did that resulted in the praise that you want to see more of. Then reflect is the R in PRIDE, and it's reflect appropriate talk. This doesn't mean you take the lead, right? Reflection is doing back to someone what they're doing. So if I'm looking at myself in the mirror, I'm seeing a reflection of what's here. And so that's a way that we can, again, build a relationship and connect while being child-led. It allows them to lead the communication while reflecting back words that they've used. Sometimes this can be helpful when I'm not exactly sure of everything the child said, because there's maybe a language impairment, but I can hear a couple words and I can get the basic gist, and I want to let them know that I'm listening and understanding. So I might repeat the last word. So if they said, I built the train track, and I hear it clearly, I'd say, you built the train track. Or maybe I'd say train track. You can repeat back the whole statement, but sometimes kids have big, long stories. And so maybe you just say back part of it. That's okay. You are reflecting back to them, which says, you're important. I hear you. I'm with you, right? So the example here says, I did it all by myself. And the parent or the adult could report back or reflect back, you did do it all by yourself. Right? With warmth, genuineness, and kindness, we are reflecting back things that they say. That also can help reinforce that language that they're using. That may be important if you're working with kids with autism who may have language difficulties. And really, it lets them know you're listening and understanding. Gosh, that's really important when we're building a relationship. It's important for the other person in our relationship to know that we think that they're important, that we're listening what they're saying, and there's no questions, right? It's just a statement. We're not building on it. It's you did build it by yourself. You do have the blue and the red blocks. You do have oranges for snack, right? So it can be labeling these things. And that's reflection. And that, again, this is about how to build the relationship with another person. So we've talked about praise and reflect, and on to I for imitate. And imitate appropriate play. This does not necessarily use language. You can, the example here has language. Sometimes this can be helpful when our kids may be overwhelmed with language, right? If our kids, again, with autism or developmental disabilities, too much language or language in general might be too much stimuli. So this can be a way to join with them, connect with them without using language. You just do what they're doing. So let's say a child is stacking blocks. I may come up, I may be in the room with them, and next to them, I just start stacking blocks like they are. I'm not saying anything. Again, here there's the option to label. I'm going to tap blocks quietly like you. That's always an option. And again, it's that imitating that play, so we can imitate behaviorally without the language. So again, it's a way to connect with the child or the learner. You can use language or not. And again, I find that this is a really helpful strategy to teach behavior technicians who are so used to connecting through language. And so many of our kids, we serve kids with autism and related disabilities, they really struggle with language, both expressive, so saying it, and receptive or understanding it. So it's possible that us constantly talking is too much. It's also, I love an acronym, right? WAIT, why am I talking? And so sometimes we don't need to talk so much. We might be trying to fill in the silence. We don't need to do that. And it may not be good to do that, right? And so imitating their appropriate play is an option for connection and joining that does not include language, right? So it can show approval of the play, and approval meaning whatever they're doing is enough. Right? We don't want to imitate if they're punching another child or doing something that's unsafe. But it also doesn't mean that we only imitate the play that looks like I think the play should look like, right? I think it's okay and maybe even important to connect and show another individual that I think what they're doing is enough, and that I see that they might be doing something different, and that's okay. Again, as long as it's not hurtful or harmful. So doing what the child is doing, stacking blocks on their head, maybe I stack blocks on my head, or looking for a pen, maybe they're sort of playing with things like a mustache, and maybe I do the same thing, where they're coloring and I come up and kind of scribble on the paper with them. Doesn't mean I necessarily sit down and draw this great artwork. Maybe I really sit down and do just what they're doing. It can be drawing, but it also is okay that if they're scribbling, because that's developmentally where they are, I sit down and scribble it. It's saying, I see you. I see what you're doing. It's important. You're important, and I'm paying attention to you. Okay, so we've got the P for praise, and we want to do that labeled praise or specific praise. Then we've got reflect, which is us reflecting back what they're doing and saying. Imitate, which is sort of doing what they're doing. It can include language or not. And then we've got describe, describing appropriate behavior. This I think of as being a narrator of their life and what they're doing. I often think of like Morgan Freeman's voice. I'm not necessarily playing, and I'm definitely not directing their play. So it's not saying what they should do. It's just describing what they're doing. So you are rolling that blue ball across the floor. You're smiling when you're doing it. I think that means you like it. You're happy. Now you picked up a dog instead, and the dog is bouncing on the trampoline. I'm just saying what they're doing. They're doing it as I'm saying it. So it's not like I'm giving them a direction, like have the dog jump on the trampoline. You're just, remember, this is child directed. And so part of that process of building rapport, connection, is doing less directing and showing them that you see that they're important. So it's just describing what they're doing. It's a great way to model language. So again, we want to be sure that all of the language that we're using is appropriate for the child, which means like that big sort of dialogue I just did, that might not be appropriate for somebody who has no vocal verbal language or no communication yet, or no verbal communication yet. I might say, blue balls rolling. You can use less language. We want to fit it to what the child is doing, right? Maybe a step above, but we want to keep it pretty similar to the language the child's using. And then describe what they're doing. not directing. It's just describing what they're doing as if you were narrating what they were doing in a movie. It allows the kiddo to focus on what they're doing and to really be immersed in the play, and you're a part of it, but we're not in the way, right? I'm not directing it, I'm attending to it, and I'm not really a part of it. They don't have to tell me what to do. I'm just describing what they're doing. This one, you're keeping the Play-Doh on the table. That can be like some praise, right? Because you're telling them you like that, and that's certainly okay to do. It also can be just like I did. You're rolling the Play-Doh into a ball. Now you picked up the green Play-Doh. You're keeping the Play-Doh on the table, which is great, right? So I sort of put some describing the play and added some labeled praise in there. So it's like a twofer, which is great. Describing it, what we find is I'm sort of, maybe you notice the pace in my voice. It's slow. And if a child's moving really fast, if I'm describing what they're doing, and I wouldn't want to go super slow because then I might miss stuff, but going a little bit slower than what they're doing may help slow them down, because they're kind of tuning into your voice, and it's almost like setting the pace. If that doesn't work and the child is still moving really fast, then maybe we don't want to use this one yet, right? That's totally okay. Okay, so we've done P for praise, that specific labeled praise. R for reflect, that appropriate talk. We're giving their language back to them, not exactly, right? So it's also great to help with the maybe some of that rigid language. We can say it back to them in a slightly different way, which is also modeling similar but different language, saying the same things. You want to keep those main words the same. So like car, if they're playing with a car, or they're doing something with a car, we want to be sure to mention the car. And then imitate, we're imitating their play, can be with language or without, but it's really just doing what the child is doing and joining with them behaviorally. Describing the behavior, so what are they doing? Narrating what we're watching them do. Again, these are all about great ways to build connection with kids and allowing it to be child-directed. Because really, if you think about it, as kids, most of their world is adult-led and adult-directed. And so this gives them space for it to be child-led. And we can still influence, right, in some ways, some of the things happening with that labeled praise. But it's really about connection, letting that child be in charge in an appropriate, safe way to help build connection with them as we're establishing that relationship, which we should be doing every session, multiple times per session, right? This can be done in 10 minutes, 5 minutes. When you give home fun, which is what you call homework, it's really these 5-minute sessions that's just child-led. So we can be doing this multiple times throughout session to be making those deposits in the relationship bank account so that we can make withdrawals by asking them to do work. Okay, so we've done P, R, I, D, and the last one is E, enjoy, and they save the best for last. Enjoy what we're doing. Enjoy that child. Enjoy that you have time that you have set aside to just focus on enjoying this time with the child. It's not about how much they're doing, what the correct responses are, what you have to do after work, before work, what happened 2 trials ago. Be in that moment. In this moment, I'm really enjoying my time with you in a genuine way. Kids feel that. Hell, adults feel that, right? When somebody really is enjoying time with you, we feel it. And so it helps the child connect to us. But the cool thing is it also helps us connect to the child. And relationships are 2 ways. And so we give our best to those we feel connected to. And so building these relationships not only benefits the child, but it does benefit us as well. So it demonstrates interest in the child, models positive emotions directed towards them. A lot of times kids hear a lot of correction throughout the day, particularly our kids, because they're coming to us because they're struggling in other settings in some capacity that they need intervention. So they may even be getting more correction than the average bear. So saying things like, I have so much fun playing with you. I'm really glad you're here today. I was so excited for our session. I'm glad we're playing Legos together. don't say it if you don't mean it. And if you really can't find it in you to say that and mean it, it might be a really good time to talk with your BCBA, BCABA, your direct supervisor about that, right? That it happens, and part of our responsibility as the professionals is to make sure that we are giving our clients the best. And so if we're really having a hard time enjoying ourselves with a client, I think they feel that. And it's our responsibility to make sure that each child, each teen, each adult, however we're defining client, has someone working with them who really believes in them and is stoked on them and is helping them move towards their goals as effective and efficiently and enthusiastically as possible. And if we're having a hard time doing that, then I think it's our responsibility to let someone know so that we can make a change, because it's okay. It doesn't mean you're not a great person or that you're not a good clinician and you can't work great stuff with the next kid. It means that sometimes the milk is soured. And if you're noticing that you really are struggling with this this enjoyment, we may need to make a change. Now, there's things that we can do before that, right? Do more of this. Focus on the things you really enjoy about the child. And if you're struggling with that, then it's important to talk with your supervisor openly, honestly, vulnerably, and courageously, because that shows professionalism. It shows that you are prioritizing the needs of the clients you're serving. In the Behavior Analyst Professional and Ethical Compliance Code / Ethics Code, we do need to acknowledge when there is something going on for us that is negatively impacting our ability to serve others. And that can be all others. But I also think, like any client, right, if I need to take a break from being a clinician, but I also think that it applies for individual clients. If I'm no longer effective for this client for whatever reason, I need to tell someone that so that we can make a change. That can be scary, and it's also scarier the potential damage we can do, because our kids don't have time to waste, right? They're coming to see us because they're behind. And humans should spend time with humans who really want to pour into them and are enjoying time with them. So we went through all of the pride skills. Again, this is a component of PCIT that's part of it's directly taught to parents or teachers, because there's TCIT as well, to help them connect with their students or their learners or their kids, because what we know is a stronger relationship results in greater learning. People do more for individuals they have a relationship with. They feel safer trying new things with folks they have a relationship with, because I feel psychologically safe with you and physically safe with you. So I'm more likely to try something new or different or kind of scary if I feel good about our relationship. I know you're there with me, that you see me, we're in it together. These skills and strategies help with that. Just briefly, the second page is the pride skills are the pride skills. These are different things that are components of CDI, that child-directed intervention. And so I'll briefly review them just because they're on the same handout. Again, reviewing this handout does not mean that you are trained in PCIT or able to implement PCIT. That will depend on a variety of other things like licensure laws and training and billing and a million of informed consent, a million other things. But they're super great strategies, and I want to review them for our folks. So we want to avoid no, don't, stop, quit, and not as much as possible, right? Don't tell the child, it doesn't tell them what to do instead. And if you're thinking, this sounds like behavior analysis. Yeah, I mean, behavior analysts don't own behavior analysis, right? These strategies or behavior therapy has been around for a while. And so these strategies do show up in other disciplines and other manualized interventions. So I think of it as IOA. The more places I see this, particularly when it's listed as science and evidence-based intervention, I'm like, okay, cool. Like, we're on the right track. So again, we want to tell the kids under what conditions is it yes, is the language I use. So, I don't know, but I always think of this kiddo who was 10 and who wanted to drive his dad's car because it was a really cool car. And dad just kept saying, no, you can't drive the car. Yeah, no tends to trigger, like a rar in us. So I talked with dad about under what conditions would it be yes. And dad was like, well, I mean, we could talk about it when he's 16. I said, cool, say that. So when the kid would be like, I want to drive your car, and dad could say, when you're 16, we can definitely talk about that. feels very different than, no, you can't drive the car, right? For everyone involved, it stays lower, like energy-wise. And again, that doesn't tell the child what to do. So instead of don't hit, we want to tell them what they can do instead. You can put your hands on the table. You can give me a thumbs down if you're mad at me. And again, there can be this kind of power struggles and conflict and negativity, and these things don't necessarily move us forward in a relationship, right? And this is about relationship building. Look, sometimes you have to say no, or you have to do something. It's not about letting kids do things that are unsafe. It's being aware of how much are we using this language, knowing that it does not strengthen relationships because it tends to be negative. Want to avoid criticizing. Gosh, I sure hope this isn't happening in ABA sessions, and it's written and let's talk about it. So we don't want to say to kids, you're acting like a baby, that's not how you do it. None of that tells them what they do, what to do instead. It focuses on the things that they shouldn't be doing or the things that they're doing that aren't desirable. You ever mess up? I do all the time. I don't need to be, a lot of times I know when I've made a mistake, or I know when I'm not doing something well, and I don't always need to hear it, especially crying. Gosh, when I'm crying, the last thing I need to hear is criticism for crying. Think about Dr. Brene Brown, who says the last thing we need when we're out here humaning, being vulnerable, robust humans, is somebody making us feel bad for humaning. So again, that criticism can be really detrimental to the way the individual feels about themselves, but definitely to our relationship, right? The relationship between the two people. And then this one's really important. Avoid giving commands and asking questions. Again, this is during that CDI period, that child-directed intervention. That's just these certain chunks. Well, let me say that different. CDI is a longer piece. These are pride skills that can help us build the relationship during those times. And you might be thinking, well, Dr. Becca, we're supposed to be teaching them things. We do have to ask questions. Yes, we cannot be asking questions all the time. We can't. We're asking them to work nonstop. I don't work nonstop. You don't work nonstop. We don't want the kids to work nonstop. So we want to avoid, I might modify this for us by saying, avoid giving too many commands and asking too many questions, and set time during each session where you're not doing any of that. That's this CDI. It's called, again, when we send it as homework for the parents as part of PCIT, it's called home fun. And it's to spend 5 or 10 minutes just following the pride skills that's totally child directed. And during that time, there's no criticizing, no commands and questions. Sometimes we don't realize how many questions we're asking, but a question is a command because there's the expectation that somebody responds. And if we're asking a lot of questions to kids who don't have the communication skills to respond yet, we actually might be teaching them to ignore questions, that it's something to just ignore and not respond to or not attend to because they can't yet. But that's not on them, that's on us. Make it a statement. Let's play with the toys. Not, are you ready to play with the toys? Don't make it a question if the answer can be no, first of all. So if you're ready to put your pants on and you got to put pants on, just say, it's time to put our pants on. Now that's a command, so that would not, kind of go in here. But we might say we're playing with the toys, right? We're labeling. I'm turning this command into that labeled sort of describing what we're doing. Look at this. What are you making now? What color is this? These things are requiring the child to do something. So the child is no longer in control. The adult is, because we're telling them to do something or either do something behaviorally or give a verbal behavior of answering the question. So it could be like, we're playing with the toys. I'm watching you look at this item. Looks like you're making a snake. This color is a very pretty blue. These are ways to take the same content and turn it into one of the other pride skills. I hope that this is helpful. It's so important to focus on our relationship with our learners, whether it's our learners, little kids, teens, maybe even with parents that we're working with, right? So I don't want to be criticizing parents. I don't always want to be asking questions and giving commands. That seems bossy. They're in control, right? I am working for them. I am helping them improve, whether it's their relationship with their child, like in PCIT, or helping them help their child be more successful. They're the expert on their child. I want to minimize no, don't, stop, quit, and not. Think of the way I can tell them what to do instead, or and under what conditions can the answer be yes. So again, we've got our pride skills: praise appropriate behavior, reflect appropriate talk, imitate appropriate play, describe appropriate behavior, and enjoy your time with the child. And again, this information or these strategies are part of parent-child interaction therapy, or PCIT, which is a manualized evidence-based intervention that goes back to the 70s by Sheila Iberg, that now is really around the world, that you can read more about. Hopefully these strategies and skills are helpful in sessions, and learning these does not mean that you are trained in PCIT. PCIT is generally delivered by a mental health clinician who's gone through quite a bit of training on the intervention. And it's okay if you aren't that, right? Because you get to use some of these great strategies without it. And we don't need to do the whole intervention, and we can definitely benefit from some of these strategies. I hope that this is helpful. Have a great rest of your day.